My name is Dr. Alberto de la Fuente. I am the dermatologist here at Cosmic Clinic, and I've been here at the clinic for the last 12 years. Well, basically, when we see a mole that is suspicious of cancer, the first thing that we need to see as doctors is the ABCDE rule, in which A stands for asymmetry. If one half of the mole is different than the other half, that could be a red flag. B is the border. If the border is well defined or if it's not defined, that's when also could be suspicious or another red flag. C stands for color. If the mole has two or more colors, that's also a red flag. The D stands for diameter, in which case any mole that has more than 6 millimeters of diameter could be something else than just a regular mole. And the last part, which is the E, stands for evolution, in which if the mole changes in color, changes in size, if it's evolving or if it's evolutionating, that's exactly when we see that the lesion may be suspicious. Well, basically we have first to assess if patients have the risk factor of melanoma. Patients that have really fair skin, what we call phototypes 1 and 2, are the highest risks of patients that may develop melanoma, and more than 2 severe sunburns during any part of your life. But continuous and prolonged sun exposure without sunscreen or without the reapplication of the sunscreen, that's the #1 risk factor still, sun exposure and UV radiation. Basically, and the problem is that most of the skin cancers, even if they're not melanomas, they have no symptoms. Usually patients come to the clinic just to see if their moles are benign or if they're suspicious, or sometimes at all they just think that it's a pimple that it's not healing or an ulcer that it's not healing. So basically the experience is that most of the cancers won't give you any symptoms at all until they're large enough to become infected or to produce any type of disfigurement that sometimes the patients come here to check, or sometimes the relatives of the patients are the ones who take the patients here to the clinic for an assessment. So once you have the diagnosis of melanoma, it will affect your daily life because you need to restrict the sun exposure, your sun habits, the use of a sunscreen, and after the melanoma is removed, depending on the stage that it was detected. Sometimes patients need also chemotherapy besides surgery. And obviously that disfigurement could affect obviously the quality of life, yes, of course. The problem is that sometimes sunscreens give you the false sensation that once you wear a sunscreen, you can stay outdoors for 2 or 3 or 4 hours, and that's not enough. We need to use physical protection, like rash guards, umbrellas, protective shades, sunglasses, also moderate sun exposure. Even though if it's cloudy or overcasted, the radiation still goes through the clouds. So the #1 thing that we need to do is to prevent the direct sun exposure on the skin. The recommendation is to reapply the sunscreen every 2 to 3 hours, no matter if it's an SPF 50, if it's an SPF 30 or a 100. And also what is really important is to reapply the sunscreen in the peak hours of the UV radiation, which usually it starts like around 9 a.m., 10 a.m. and during the summertime all the way up to 4 or 5 p.m. So every 3 hours at most, the recommendation. If patients are going to stay inside the pool or in the ocean, then the reapplication needs to be at least every 1 hour to 1.5 hours, because water basically wears off the sunscreen faster.